Good evening, viewers. Welcome back. Thanks all again for your response last week, last month. And this is a heart failure awareness week that we are celebrating this week. So I decided to choose on this topic and discuss about heart failure and causes of heart failure, how relevant it is actually, and how far should we understand the cardiac health and heart health perspective. Without wasting much time, probably let me take 15 minutes time for my views. Then let me take next another 10-15 minutes time for questions. And apologies for my voice since I'm running the sore throat and my voice is not may not be that clear. So heart failure, a few couple of things which I think I strongly feel everyone should understand and know. Heart failure is different. Heart attack is different. Heart failure is a broad term. Impairment of heart or inefficiency of heart or heart with the purpose which it is designed for, it's not serving or meeting the requirement. That's heart failure. To keep it otherwise simple or to understand it slightly better, heart's normally efficiency of pumping is assessed in the form of a easy parameter called ejection fraction. Most of you would be aware by this time. Normally it is 55 and above. If ejection fraction or pumping ability otherwise means starts going down, it otherwise indirectly says heart's efficiency is going down. So why should it occur? We come to it little later. So how does it present? As age advances, every organ starts deteriorating. Even heart goes along the same direction, and heart sets in failure. So heart failure is again not an all or nothing. It's a broad spectrum. It might be in the early stage where symptoms would be bare minimum or no symptoms at all to minimal symptoms, to the extreme end where symptoms are like even symptoms happen at even at rest, and symptoms are terrible in spite of best possible medication. There will be persistent symptoms affecting quality of life to the extent requiring heart transplant as an option. So this is a broad spectrum. So what are symptoms of heart failure? Probably hearts, if we understand back again, I mean heart again, or if idea of heart again, hearts 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 pumping or hearts as an organ is designed to pump blood and circulate the blood to every organ in the body. So in the process of pumping blood, it actually drains blood or drains fluid from lungs where the blood is purified, that is purified at lungs. Heart drains the blood from lungs and pumps it and spread to whole body. So if heart is not pumping effectively, there is a forward failure as well as backward failure. The forward failure means heart is not able to generate adequate pump pressure so that every organ doesn't get perfused adequately. In the initial days and the early stages, the symptoms would be easy fatigability because muscles are the ones which get affected easily. So with exertion or minimal or walking or activity, physical activity, which one is accustomed to or used to, but the same level of activity, one may not efficiently do the work which one is doing previously. So, and easily there will be a fatigability, early fatigue steps in. This is earliest sign of heart failure. And going forward, as heart failure advances, each and every organ starts taking hit because as pressure is low, efficiency of blood pressure, which actually determines blood circulation to all the organs, it goes low. Slowly kidney starts getting affected, so kidney parameters would start stepping in, liver start getting affected, and eventually even brain starts getting affected. So there will be slight dizziness in on walking and not able to walk and cloudy sensorium. uh, Physical, I mean emotional ability, physical abilities will not be that great. So these are at later stages. And one more component I was mentioning, that is backward failure, wherein heart, because heart drains blood from lungs when it is not pumping effectively, lungs are flooded with fluid. In other words, lung, which is supposed to be like a dry sponge, if the sponge, if it is dipped in wet water, it becomes heavy. And similarly, lung, which should be dry, if it is not I mean, if it is not letting the fluid which is has adequately because of inefficient heart pumping, lungs will be flooded with fluid, so easily there will be breathlessness. Lungs will not be efficiently doing, so one will experience breathlessness. So even with minimal activity, one will struggle with breathing difficulty. So again, early symptoms of heart failure is one, exertional breathlessness or breathlessness with minimal activity which one was not experiencing before. To the extent gradually, when it is worsening gradually, breathlessness will occur at rest. Breathlessness will walk around, will worsen on lying back, so much so that one may not be able to lie down actually, because lying down will worsen the breathlessness. So these are at extreme stages. So breathlessness and easy fatigability, these are very relevant symptoms for heart failure. So this is a very broad term. This is not a disease, this is a syndrome. So this is broad term because any for any reason heart takes a hit or heart is affected, heart eventually ends with heart failure. So then now coming into the causes, what are the causes for heart failure? So the commonest cause is heart attack. Heart attack again is a different discussion. So heart attack is acute hit or acute catastrophe where heart's pumping which was normal will suddenly drop within minutes to hours to and losing its efficiency by more than 50%, so creating a shock or low blood pressure and taking away lives also. But not every attack ends up lives, but the majority of attacks are subtle or mild. And the blood supply to heart is low. Heart itself again is heart which generates adequate energy and pumps blood to all the organs. Even for its own survival, it is dependent on blood supply for its survival. So all the, I mean, even heart is not if heart is not again getting adequate blood supply because of blockages in the blood vessels that supplies heart, blood vessels not, I mean, blockages in the blood vessels that supplies heart, if there is, there is a compromise, again heart will take what will be hit and slowly heart's function deteriorate, starts deteriorating. This we call coronary artery disease. So heart attack, or even before heart attack, and just subtle one like coronary artery disease or blockage in the heart blood vessels, all this contribute to heart attack. This is very commonest reason. There are many numerous reasons which cause heart failure, which is relevant for general public. Probably the other common reasons are in there is a problem called rheumatic heart disease, which used to be more prevalent in 2 decades before. The rheumatic heart disease is very much prevalent in low income or developing countries like India, and it used to affect low socioeconomic group in particular. So this is rheumatic heart disease is a disease involving walls, wherein walls, I mean, heart has compartments within which, I mean, blood facilitation between the compartments are facilitated by walls. Walls, they open and close like shutters, and if these walls are actually damaged by means of by or affected by means of rheumatic heart disease, they'll not open effectively or they don't close effectively. We call it stenosis or regurgitation technically. Either of it happening to any walls in the heart will also cause heart failure or deteriorate heart's function. And next common cause for heart failure is anemia, and this anemia again is more prevalent in women. Anemia is nothing but low hemoglobin or low iron levels will lead to low hemoglobin, and chronically somebody's blood blood has a low hemoglobin, they'll end up with heart failure. Heart anemia causing anemia causes heart failure because of various reasons, but again, every organ in the body is dependent on oxygen for its survival. Of course, hemoglobin in the blood is the one which carries oxygen. So when blood hemoglobin is low, oxygen that reaches to every organ will also be low, and every organ will start getting affected. Likewise, when heart will also get affected because of anemia. And there are many vitamins and mineral deficiencies can also cause anemia, which is again a very rarity. But one issue which I would want to emphasize, one should, I mean, or you all should know and understand, for as a common reason for heart failure is genetic cardiomyopathies. There are numerous conditions which actually affect direct heart muscle per se, because of some genetic problem which one inherit from ancestors. So the pumping efficiency will be low because muscle is actually compromised or paralyzed. Heart muscle will be a compromised or paralyzed one, and most of these genetic cardiomyopathies will start expressing from second or third decades of his life. So one, if symptomatic at second decade or third decade, like exertional breathlessness or easy fatigability or muscle cachex inability to take adequate foods, or feels, I mean, both legs are bloated, swollen, abdomen is bloated. These are classic symptoms of heart failure. If one is experiencing all these symptoms, especially in the early age group, the younger age group, like second or third decades, one should get a 2D echo test done to understand heart's function. If that's deranged, probably one should go to cardiologist to get the underlying problem diagnosed, and possibly if one is any problems can be corrected and fixed to an extent. So anyway, these are very common reasons for heart failure. Again, to sum it up, one again is heart attack or coronary artery disease. This is very most common reason for heart failure. Second is rheumatic heart disease, especially in Indian population. Third, anemia and other vitamin mineral deficiencies. Four, to put it sum it up, especially in younger age group, it is genetic cardiomyopathies. And again, there are very rare cases. Rare cases can also cause cardiomyopathies, like say any for any reason, for any different issue, kidneys are getting affected, chronically kidneys damaged. It will also invite heart because each organ, every organ in the body, they work as complement. They complement each other. They work together, help in working. They work together. So one organ, if it is affected, it will invite the other organ also to land in trouble. So similarly, when kidney is diseased, there will be inadequate filtration or inadequate passage. Inadequate excretion of fluids and many unwanted chemicals in the body. So when kidney is diseased, one will be chronically volume overload or will appear very bloated because of excess fluid retention in the body. And this excess fluid retention in the body puts an undue demand on the heart, eventually inviting heart also to problem, causing heart failure. Similarly, chronic liver disease, liver can get affected because of various reasons. We're not getting in there. And if liver is also affected with time, it will also invite heart into the trouble. So it will also parallelly cause heart failure and heart problems. Again, liver failure patients will all again be bloated. They'll be volume loaded, or this volume loader for many various reasons actually. Liver failure will also invite heart into trouble, and will end up with heart failure. So to sum it up, symptoms of heart failure are swelling in the feet or abdominal distension, easy fatigability, breathlessness at exertion or breathlessness, very rarely palpitations or chest pain on exertion. If it is happening, one should think in the lines of heart problem or heart failure. So go to a physician. Probably physician might ask us examine and assess and ask for a test called echocardiogram that will actually give an information and identify the heart failure. And then probably the physician will refer to cardiologist, and cardiologist will try to understand what is the reason behind heart failure. A majority of problems are controllable or fixable. So if it is fixed in the early stages, probably heart will not take any reversible damage and get the problems corrected very early. So that's about heart failure symptoms and common causes for heart failure, which one general public should be aware of. So now the getting into the treatment part, of course, it is for the cardiologist or physicians to be handled. So if you ask me, is it like only complex or expensive or unaffordable modalities are the only ways how heart can be treated? No, as again, and I mentioned in the my beginning, heart failure is a spectrum, broad spectrum. Majority of heart failure would actually land in the early stages or middle stages, wherein the underlying causes can be controlled and heart failure can be reversed. Even if heart failure cannot be reversed, or even if a heart failure is in the middle to advanced stages, one can be made very much asymptomatic with improving very good quality of life and leading a very good quality of life and leading a normal survival, normal duration of survival. Because there are many drugs, especially in the last 5 6 years, actually, thanks to scientific innovations that's happening in pharmacological industry, the many drugs that we have, and all the drugs, a majority of the drugs are certainly very much in the affordable prices, and yeah, like easy available for for an average human, for an average individual, even in India, to get to take them and get the problem fixed to a greater extent. And so, I mean, the pharmacological scope for pharmacological or drugs to fix the problem for heart failure is magnanimous. So only at a later, very later stages, or very late stages, probably one would require an intervention exclusively for heart failure. So what are those? Probably if one has coronary artery disease or blockages in the heart vessels, and that is causing heart failure, physician might, a cardiologist might ask for a test called angiogram and to identify the blocks. And if these blocks are quite significant, he might suggest revascularization in the form of angioplasty or bypass grafting for fixing the problem, which will improve heart's efficiency and heart failure can be regressing. And the other possible interventions one would require is if heart failure is advanced, and there are certain electrical issues also with the heart, which a cardiologist will identify it for you. One if one is suitable for a procedure called CRT, that is implantable uh, devices, I mean, or a pacemaker kind of device, wherein the battery is fixed under the skin in the chest and leads are placed in the heart, that will help in improving heart pumping or heart ejection fraction and help in reversing the heart problem. And there are many other advanced modalities for interventions happening, which are rarities and require only for rare conditions, probably not relevant for everyone to know and understand. That's probably, I mean, one to one, as and when suiting the condition, cardiologist may suggest. And eventually, when all the options are dried out and exhausted, or in spite of trying out all the options, there is no improvement in function and the quality of life is poor, BP is always low, and patient probably is little in the young or the middle age, hoping for a longer survival because most of the other organs are doing good, then one will require a heart transplant. Again, heart transplant is not like a rarity or done as a rare procedure. Now the centers which are doing heart transplant is growing up year on year across the globe, also in India. Even in India, if you see little while a decade or two ago, there were very few, less than 10 centers which took up this program and doing. Now the many centers started up doing, and the organ donation awareness has also gone up. So organ availability, because heart is a single organ which we can replace only from a deceased donor, that is who has already lost his life. So I mean, availability of organ was also an issue because of lack of awareness of organ donation in the earlier days. Now since with time, our education, our understanding of transplants gone better, our results with transplant also has gone better, much better. If you will be surprised if I say, for 2 years or 5 year 2 year survival rates after transplant is more than 85%. Even 5 year survival rate after transplant is more than 70%. And one should understand, this survival is not just survival but with a much improved quality of life and much near normal quality of life. So heart transplants are happening, and they do really make a difference to a burnt out heart, or an end stage, or a heart with end stage heart failure. So exploring for that option and getting it done, I mean, provided one is really requiring it and once stage is rightly uh, set, of course that's for the cardiologist to do. So this option is certainly there. That's the point that I'm trying to make. If elderly, or for various reasons heart transplant is not happening or not a possibility, or organ availability is a possibility, and the heart is really burnt out or in an end stage, there are again advanced modalities like LVAD or HVAD. I mean, artificial heart, to keep it very simple. And there are artificial hearts. I mean, the pump. There are artificial pumps which run the circulation throughout the body by pumping, and it's I mean, by with the help of this pump. So artificial hearts are also available, though expensive, may not be like affordable for everyone, but still, for understanding purpose, if one's heart is burnt out and transplant is not a possibility, or organs delay availability is there, there's a delay, extreme stages, artificial hearts are also available, even that option can be explored. So possibly, probably I kind of briefed what information probably one should be aware of about heart failure, and I'll I'm happy to hold on here, and probably I'll be happy to take most of your questions to relate it more with you all. So Mashika rises. What's the difference between a heart attack and heart failure? So this is again, this probably superficially we discussed, and but this needs to be understood thoroughly, because the kind of overlap in our understanding between heart attack and heart failure. Heart attack is an acute event or a sudden event, and it's a catastrophic event. Heart attack is something where there the blocks in the blood vessels that supplies heart suddenly bursts and occludes the flow, suddenly chokes the blood flow to the heart, suddenly endangering patients somebody's life by getting the pumping down from a normal to very low, so that blood pressure will suddenly go down, and to the extent shock and extreme calamity like life is at danger. This is heart attack. Heart failure is heart efficiency. Even heart attack can cause heart failure, and in fact common cause for a heart failure is heart attack or blockages in the heart vessels. But every heart attack is not a catastrophe. Majority of attacks are subtle and mild, so they'll eventually actually pull down heart's efficiency slowly or gradually, and ending up heart into heart failure. Heart failure is a gradual phenomenon. Heart failure is because of inefficiency in the entire heart muscle, as as a bulk, that can happen because of various reasons. Heart attack is one reason for one of the causes for heart failure, but heart failure or muscle dysfunction of heart can occur because of various reasons. Whereas heart failure is more like, it is a gradual acquired thing with sudden dips or sudden deterioration and sudden recovery. But heart attack is an acute event or a sudden event, and it's a catastrophic event. Mr. Pranchul, raises, why are so many young people having heart attacks even after keeping a healthy lifestyle? So, tricky question. Probably on the first statement or first half of your question, I agree with you. Many young people having heart attacks. I totally agree with you. I probably would also relate it with the data that we have from Registrar General of India, that heart attacks happening in the younger or premature age group, that is less than 45 years, have actually gone up by 30% in the last 1 decade. These are absolute numbers. So certainly, heart attacks are worsening. Prevalence of heart attacks, incidence of heart attacks are going up. Prevalence of heart-related problems are growing up. So, but the next question is, even after keeping a healthy lifestyle, I really doubt that. It's certainly not a healthy lifestyle is not getting healthy. I mean, from the entire population perspective, it is certainly not healthy. In rather, our lifestyle is getting worsened with time. If you look at our obesity prevalence, it has doubled in adults in the last 3 decades, and it is tripled in children in the last 3 decades. See, children, three times the obesity. In the last 2 3 decades. That's a scary thing, because all these children will slowly in a decade or two will become adult, and they are likely to develop heart attacks at younger age group. Probably I just shared 30% increase in prevalence of heart attacks. in the last 5 years. But if you look down, if we go down, probably after 10 years, you might see a 50% or even more increase in heart attacks in the younger age group, because majority of our children are obese. That again indirectly says that our lifestyle is not healthy. Our consumption of calorie content is not adequate. I mean, it is over adequate or undue excess of calories that we are consuming, and not just by consuming excess calories. The the quality of calories that we consume is also unhealthy. We are I mean, we are eating more uh, saturated fats or refined foods or processed or industrialized foods. We are eating more baked foods, bakery based, or just, quick made foods or fast foods and fried foods, which is certainly not that high 2 or 3 decades before. Certainly our lifestyle is healthy, heading in a wrong direction. The food consumption patterns is not good. Also, if you look at physical activity, majority of our livelihood was based on our physical activity before. Now most of us are like stuck indoors, or most of us are like working with only with our brains and limiting our skeletal muscles efficiency, or limiting compromising it. So physical active my point is physical activity has gone down, taken a significant dip in the last 2 3 decades. Even that's not counting for a healthy lifestyle. Because of our lifestyle, we are acquiring this problem, that is heart attack. So our heart attacks in younger age group is getting worsened, certainly yes, but certainly not because of healthy lifestyle, because of worsening lifestyle, because there is enough data to say that we are heading into and we are significantly tilting into a very unhealthy lifestyle. Hope that concludes Pranchal. Mr. Akshay raises, which kind of people have a high chance of heart attack? Again, the previous question partly explains this question as well. So, major or most important thing in preventing heart problems, be it heart attack or heart failure, is lifestyle. If our lifestyle is healthy, our chances of acquiring heart attack or heart failure is low or less. So and again, one common reasons or common causes for heart attack is hypertension, or otherwise blood pressure, diabetes. And these risk factors prevalence will also go low if our lifestyle is very healthy. And healthy lifestyle not just gives a healthy heart, also it gives a overall good health. Not be It doesn't again confine only to heart. For most of the organs, lifestyle plays a major role and takes a top priority in the prescription of the physicians in the health interest. So, healthy lifestyle, when I say it is how, what, when, and how we eat and we sleep and we move around is healthy lifestyle. So eat, eat adequate, eat healthy. Don't eat fried foods or processed foods, and eat healthy foods. Eat adequate foods. Don't go over excess calories. Don't eat sugar sweetened foods. There are unhealthy foods. And exercise at least 30 to 40 minutes a day, at least 5 days a week. Preferably do more cardio exercise, and optimal mixture of both cardio and resistance exercise is a healthy way of doing exercise. And sleep at adequate, that is, say sleep excuse me, sleep at least 6 to 7 hours uninterrupted quality sleep is also important. Probably moving little away from these electronic gadgets will also help in improving our sleep quality and quantity. So adequate uninterrupted sleep, healthy food habits, and healthy exercise will take care of major share of our health problems, and probably one would actually don't would not require insurance at an early age. Health insurance. Sakshi raises, are numb and tingly hands a common sign of impending heart attack? No, no, certainly no. Uh, because they should not. Heart attack rarely can give the symptom, a tingling sensation or any vague sensation happening in the hand, especially in the diabetics. This could be only sensation of heart attack. But all the numb and tingling hand sensations are not heart attack. These are very rare presentations of heart attack. So numbness or tingling hands uh, should not be clubbed or connected with heart attack. Numbness or tingling ants are happening. It only signs of nerve failure. It could be local nerve failure, or it could be spondylosis. It could be anything. Commonly, it is because of diabetes and diabetic neuropathy. So it is certainly not a sign of heart attack. And if that's happening, please don't get confused for your problem to heart, and don't start worrying. Mr. Kalaivan says thanks for the information. Thanks from my side. Thank you all for your patience. If there are no more questions, probably I would wish to conclude. Yeah, no more questions. So let me conclude. Thank you. Thank you all. Thanks for your time. Thanks and good day.